Members, today I'm presenting AB 2540, the Community College Student Right to Access Act. And first I want to thank the committee staff for their incredibly hard work and partnership with my office, as well as the community colleges for their thoughtful engagement. We will be accepting the committee amendments today, and we're very grateful for your work and attention to this. 4 years ago, the United States Supreme Court overturned Roe versus Wade, and with one decision, the court stripped away a constitutional right that millions of Americans had relied on for nearly half a century. My 17-year-old daughter has less rights than I did when I was 17. It was a devastating step backward for reproductive freedom. California, of course, responded by reaffirming our commitment to reproductive health care. And California has long said that access to care should not depend on who you are, where you live, or how much money you have. But today, that's what is happening for many college students in our state. Imagine two students living in the same community. One attends a UC or a CSU, the other attends a community college. Both are working towards a degree, both may be balancing jobs, family responsibilities, and the pressures of school, and both need access to reproductive health care. But only the student at the UC or the CSU is guaranteed access to medication abortion services through their campus health system plan. The other student at the community college may have to navigate transportation barriers, take time off work, find a provider miles away, or simply go without care altogether. And these are stories that we've heard from real students who attended our press conference, who continue to tell us how this is hard to overcome. And the reality is the student facing those barriers is often the student who can least afford them. Community college students are among the most diverse students in California. They are more likely to be low income, more likely to be first-generation college students, more likely to be working while attending school, and more likely to be balancing family and caregiving responsibilities. These students are doing everything we ask of them. They are pursuing an education, building a future, and strengthening our workforce. Yet when it comes to access to reproductive health care, we are not treating them the same as students attending four-year institutions. And that disparity is what AB 2540 is really trying to correct. This bill expands equitable access to medical abortion services for students attending community colleges by requiring colleges that have existing health service centers to provide these services. Access to that care should not depend on whether a student attends a UC, a CSU, or a community college. And this bill allows services to be provided through existing campus health centers, through telehealth, through contracted providers, or community partnerships. It also improves transparency by requiring colleges to publish information about available sources so students know where they can turn for care. This bill really comes down to this. Community college students deserve the same life-saving access to reproductive health care. And with me today, testifying in support, is Odi Kunthar with the Student Senate for California Community Colleges, and Dr. Michelle Gomez, a family physician who has provided primary and abortion care for over 20 years. Thank you.
Good afternoon, Chair and members. My name is Odi Kunthar, and I sit here as a Legislative Affairs Director for the Student Senate of California Community Colleges, the official voice of 2.2 million students across California. My support for this bill is rooted in my experiences working in basic needs at my college, where as a president of 7,000 students, I witnessed firsthand the significant disparities in resources and support available to community college students compared to students in California's other public higher education systems. These experiences have reinforced for me how important it is to advance policies that promote greater equity and ensure community college students have access to the support that they need to succeed. AB 2540 is an effort to provide equity when it comes to reproductive health care to some of our most vulnerable populations. While students at UC and CSU campuses already have access to medication abortion services through SB 24, community college students who are more likely to be low income, working, and place-bound often do not. Students in remote areas, such as up far north, often do not have access to the same services that students in urban regions may have, and our students who are struggling to make ends meet may not have reliable health care. With this discrepancy, students in the community college system are disproportionately affected and cannot access timely reproductive care. Instead, they may be forced to miss class, delay their education, or drop out entirely. This matters most for the students who are already navigating the greatest challenges: foster youth, undocumented students, students of color, and first-generation students who have the least margin for disruption in their lives. Barriers to healthcare are barriers to college completion, and access to these resources expands on the equity work that should be strived for in healthcare and higher education. This bill affirms dignity and autonomy when students seek support and ensures students are well informed about these services and how to access them. It also affirms a simple truth. Community college students deserve the same standard of care as any other student in California. We respectfully urge your aye vote. Thank you.
Good afternoon, Chair Perez and members. My name is Dr. Michelle Gomez. I'm a family medicine physician who has provided primary care and abortion care in California for over 20 years. I'm also the proud mother of 2 teenagers, including a daughter who just completed her first year in college, so this bill is particularly important to me. My daughter's 2 best friends from high school are both children of immigrants and are attending community colleges in California. They're like daughters to me, and they deserve access to the same excellent health care as their peers at 4-year colleges. If we truly believe in reproductive freedom, justice, and equity in California, then we must pass this bill. Medical professionals are often asked to learn and do new things, and this is no different. We must not let unfounded anxiety get in the way of doing what's right. Colorado has mandated that all institutions of higher education, public and private, including local district colleges, must provide medication abortions, and California can do it too. 40% of California counties have no abortion provider, but there's a community college in all of those counties, so this bill would truly help increase access. My tiny primary care clinic started offering medication abortion back in 2000, 26 years ago, right after mifepristone was approved by the FDA, and it's easier now than ever. I was honored to help the Sonoma State University Student Health Center implement medication abortion services after SB 24, and a few years ago I helped the UCSF Women's Health Primary Care Clinic do the same. What has been universally true in my experience is that it feels scary before starting, but afterwards providers tell me they were surprised. It's not medically or technically difficult at all, and it's extremely rewarding to help young people think through their options. This is exactly the type of care the community college health centers provide, in their own words, accessible, short-term, acute care to support student success. Routine ultrasounds and even routine follow-ups are no longer required. California has already funded the Reproductive Health Service Corps to provide free trainings and the Reproductive Health Hotline to provide immediate free support to providers. There are also call services to help with patient questions after hours. In support of healthcare equity, I respectfully request a yes vote on AB 2540. Thank you.
Thank you for your presentation. We'll now hear from Me Too's and support. If you could use the mic at the railing.
Ryan Spencer, on behalf of the American College of OBGYNs, District 9, and the California Medical Association, both in support. Thank you.
Adam Keglin on behalf of California LULAC in support.
Leah Barrows on behalf of Planned Parenthood Affiliates of California in support.
Darba Bautista Zavala on behalf of Unite for Reproductive and Gender Equity and the California Latinas Reproductive Justice, both co-sponsors.
Jennifer Robles with Health Access California in support.
Martin Radosevich on behalf of Reproductive Freedom for All California, co-sponsors.
Symphony Barbie on behalf of the ACLU California Action in support.
Good afternoon, Shrivika Pillari Seti on behalf of the Lieutenant Governor Eleni Kounalakis in support.
Francisco Ornelas with the University of California Student Association in strong support.
Yancy Garcia Montes, also on behalf of the University of California Student Association, and we strongly support this bill. Thank you.
Hello, my name is Candice Van. I'm a student at UC Davis, also with the UC Student Association, strong support.
Angel Marie Taylor with Black Lives Matter Grassroots strongly supports.
Hi, my name is Michaela Ellis. I'm a student at SFU. I'm a member of Black Lives Matter Youth Vanguard, Vaccine Union, who all support this bill.
My name is Melissa Aro Jerez. I'm a Chico State student. I'm in full support.
Thank you to all those who spoke in support. We'll now hear from witnesses in opposition.
Chair and members, my name is Leandra Wells with the California Family Council. I'm here today in opposition to AB 2540, which promotes and expands access to abortion drugs on community college campuses. I know what it feels like to face a pregnancy you were not prepared for. At 21, I was in the first semester of my final year of college when I found out I was pregnant. My husband and I were door dashing to make rent. I was taking 5 classes while working. I was overwhelmed and afraid. Exactly the kind of woman AB 2540 claims to help. This bill tells women that an abortion pill is the easiest solution. But fear is not a reason to end a life, and ending a life is not health care. What I needed was real support. A local pregnancy center gave me food resources, free ultrasounds, affordable baby essentials, accessible childcare, and parenting classes. What vulnerable women need is resources and encouragement to know that a baby doesn't mean the end of your education or your future. Additionally, abortion drugs are not safe. Imagine, I've heard so many stories of women who are bleeding out on their bathroom floor looking at their fully formed little tiny baby in the toilet. This is not safe. Expanding and promoting these services without immediate access to emergency care puts students at risk. So what problem does AB 2540 actually solve? Abortion is already widely accessible in California. You can have pills mailed directly to your home. Expanding that access on community college campuses doesn't fill a gap. It just normalizes that message that motherhood and college are incompatible. If we truly want to support women on college campuses, fund adoption services, safe surrender sites, childcare, a meal plan, and parental resources, that is what works. My story proves that. I completed my degree 3 weeks after my son was born. This bill tells women they cannot have an education and be a mother. But we all know women are far more capable than that. So I respectfully urge a no vote on AB 2540. Thank you.
We'll now hear from Me Too's in opposition. If you could use the mic at the railing.
Justin Selnick on behalf of the Health Services Association of the California Community Colleges. HSA still has an official opposed position, but we did want to express our gratitude towards the sponsor and the authors and committee staff for the work on the amendments. And the amendments that are outlined in the committee analysis should remove our concerns and our opposed position. And also, I am here on behalf of the California Community College Chancellor's Office, just to echo the comments of HSA. Thank you.
Andrew Martinez, Community College League of California. I want to thank the author, the sponsor, and the committee for the amendments, and we look forward to seeing the bill in print, and thank you so much for your work with us. Thank you.
David Bollag of the SFE Alliance in opposition.
Florentina DeGennaro with Moms Army, representing thousands of moms here in California, also part of Church of Glad Tidings, and representing myself as a person who grew up and was believing all of this, and now I'm a mother in my 40s and regret the choices that were made. I'm Latina, grew up in low income, and if I could show you my family and friends that regret all of this.
Me Too. So
yes.
Just your
Thank
position
you.
on the bill. Thank you. All right. Seeing as we have no one else standing, we'll turn it back to committee, and we do not have any other committee members here right now. So Assembly Member Stephanie, I support your bill. My recommendation is an aye vote. I'll turn it over to you to close.
Thank you, Madam Chair. And I just really want to thank the student leaders who have been such a pleasure to work with on this. I'm looking forward to this bill getting passed. And I want to thank also the community colleges for hanging in there as we continue to make amendments. I know that once these amendments are in print, they are going to be okay. And one of the things I love about this job is consensus building, and we've been able to take this bill a long way. So I appreciate your support, Chair, and I look forward to others voting on it when they get a chance. Thank you.
Certainly. And once we have another member, he will be able to do a motion. But thank you so much, Assembly Member.
Thank you.
I see we have Assembly Member Al-Hawari here to present her bill, AB